This is Channel 7 News at 6.
Well, good evening to you. The Arkansas Department of Health is warning the public about a sharp rise tonight in the number of whooping cough cases around the state.
It's a bacterial infection that is highly contagious and dangerous for some. Channel 7's Ashley Lunningham has the latest on what health officials are saying about it tonight. Ashley.
Chris Beth, reports from the ADH show over 200 whooping cough cases have been reported, which is 5 times higher than last year. And health officials share what you can do to prevent the spread.
The Arkansas Department of Health is sounding the alarm on rapidly spreading whooping cough.
And as of today, we had over 210 cases of whooping cough that have been diagnosed, and we get notifications of cases almost every day or at least every week. In the U.S. last year there were about 4,000 cases, and this year it's almost 25,000 cases.
Dr. Naveen Patil says one of the contributing factors to the rise is parents are opting not to get the vaccine or give it to their children. Whooping cough can start off as a mild cold, but a weekend and it can cause coughing fits that last up to 10 weeks. And those who are at higher risk could be hospitalized.
They may not have severe disease at all, very mild symptoms, but actually they transmit the disease to others, especially vulnerable population who are not vaccinated, elderly people, immunocompromised, pregnant, and especially babies, for whom it can be a very severe disease and even fatal.
The most recent cases reported are from young children and teenagers. Jacqueline McEwen with the Little Rock School District says while they have only had a few cases, there are ways to keep whooping cough from spreading, basic hygiene practices, and getting vaccinated.
Make sure that our kids have the vaccines. So if you have not gone out and gotten a vaccine yet for your child with the DTaP or the Tdap, make sure you're taking them. You can go to the Arkansas Department of Health to get vaccinated. You can go to your primary care doctor to get vaccinated, but make sure you get those vaccines.
Over 50% of counties in the state have reported cases of whooping cough. So as we go into the holiday months, Patil says to stay aware and talk to your healthcare provider about treatment.
Babies, elderly people, people who have underlying conditions, who are pregnant. So just use common sense precautions. If you are sick, you can actually take an antibiotic and prevent from getting the disease. So, there are a lot of options. And again, this is a totally preventable and curable disease. So, there's nothing to fear about it, but you just have to use the common sense precautions.
Well, there are multiple districts that have reported cases across the state. The department is currently working to determine the full number at this time. Patil says once you start to age, immunity from the vaccine starts to slow. He suggests getting a booster every 10 years once you are no longer a teenager. On your side, I'm Ashley Lunningham.
All right, Ashley, thanks a lot. And health officials say there's been at least one case reported in 30 different counties across the state.